regeneration rather than repair, because repair, it can cause scar. So that is why you need to make sure if you want to use biostimulator or even non-HA fillers, you need to keep it to only the regeneration. More regeneration, less repair. And this is all the repairing, pathologic wound repair. You can end up and cause scar formation, which we don't want. We want the normal collagen to get produced, not the scar collagen. Biostimulator or fillers, non-HA fillers, and biostimulator can act as foreign body. It won't fit into any of the category in our body. So that is why our body is trying to, get rid of it. So let's learn about the foreign body reaction. Look at the normal wound repair. So, you get, again, bleeding, inflammation, proliferation, and remodeling. But if you keep having the foreign body, you will get acute inflammation when you get the new one. But if you cannot get rid of it at once because there is a foreign body still there, the way you are handling product, the way you reconstitute, the way you inject, the dose is totally different. So which means you need to really learn and make sure that you understand each individual product very well before start injecting into the patient's body. The other things that you may need to know is how it's look like underneath your skin. These studies also show after using injection in the ultrasound, you can see that, radius or CAHA had linear white thread. You can see the white substance underneath because it's calcium, right? But if it's PCL, elongate, it will look like a snake. But with PLLA and Profilo, you will see the circular shape. So which means it's cohesive together, very difficult to break it. So that is how it, the nature of each individual biostimulator that act differently underneath the skin. I think my part will end here because this is how I would like you to know and understand biostimulator, to know that
collect the adverse event of the HA. You can see this is HA and radius and scalta. So this is a complication. For the radius, infection is the most common complication, followed by pain and swelling. But for the scalta, nodular formation is the most common, followed by the infections. And for the HA, the most common complication is swelling. And if we look into the locations of the adverse event, you can see that for the necrosis, it usually occurs on the lip, on the nasolabial fold and the cheek, while blindness, it usually occurs on this area, periorbital, forehead, and dorsal aspect of the nose. And for the fillers, scalta and radius also cause more blindness. To answer the questions, most common complication in overall injectable, for 10 years data analysis retrospective. For the HA, the most common is swelling. For the PLLA, usually granuloma and nodule, and followed by infection. But for CAHA, infection and followed by pain. And for the serious complications, blindness is caused more from the PLLA, followed by HA and CAHA. Another biostimulator is the PDLLA, which is, you already knew that it stimulates collagen less than scalta because it's less inflammation. So the report cases will be like a local site reaction like mild swelling, bruising, pain, not much serious adverse effects. But however, recently there is the article from Taiwan that report the multiple brand retinal artery occlusion after inject with the PDLLA. And in this case, after trying everything, the patient recovery a bit, but it's not 100%. But however, you can see that maybe it's not from just only PDLLA because this is the site of the injection. You can see pinhole wound with in this article, we are not certain that the physician use needle or cannula. But if you see that if the patient use needle and is poked too deep in this area, it can attack the supratrochlear and supraorbital artery, because in this area the artery still run very deep.
Good discussion. Yeah,
But
Patrick.
but hopefully all of you like learn something new.
Oh, definitely, definitely. It's a very comprehensive talk by Thanya and Rungsima, and we definitely have gained a lot from today's webinar, right? Patrick, any last words?
No, actually, these two princes are is actually hero today, because you emphasize something that probably a lot of practitioners underestimate. So that's really so important that you both share your thought. And I was so lucky because I know Rungsima and Thanya are expert in this field. So I was so lucky to have you both today.